Right, welcome to the International Public Safety Data Institute's August webinar. My name is Alex Trotman, and I'm the Customer Success Manager at IPSDI, and we're thrilled to have you with us today. For those who may not be familiar with IPSDI, we are a collaboration of fire service organizations built from partnerships we have developed for many years. The IPSDI is a nonprofit research and data science organization, and we host these monthly webinars to provide information to enhance what you do at the local level and give you another opportunity to get insights for decision making at the operational level, the prevention level, or the pre-planning level, all of which depend on good data resources. I want to let you all know that we're recording this session so we can post it on our training tab on the IPSDI website, so you can go back and reference the information shared or share it with others. During this webinar, you'll be able to use a chat function at the bottom of your Zoom screen to ask questions. And I also want to remind you that this is the first part of a two-part series, the second of which will occur on September 23rd. So we will put the registration link for the second session in the chat so you can register if you have not already. And with that, I'll hand it over to Dr. Stanley Gilbert to introduce himself and our special guest for today.
Hi, I'm Stanley Gilbert. I work for the National Institute of Standards and Technology just outside of Washington, D.C. We do a lot of different things. For those of you who get time service, that's one of our functions out of our Boulder office. I, in particular, work primarily in the subject of fire, domestic, and to a lesser extent, wildland fire. And I'm an economist, and I do research on these topics. Today's presentation is from a group from the city of Surrey in British Columbia. In 2008, they started a public safety education program that has ended up having a tremendous success. They've reduced residential structure fire rates by 70%. They've reduced fire-related fatalities by 40%. This seminar is in two parts, as we've already mentioned. Today's session is focused on research and the goals of the program. The session in September will be focused on the operationalization and delivery methods. We have three presenters today. Larry Thomas is the fire chief for the City of Surrey Fire Service. He is the City of Surrey Emergency Planning and EOC Director and the response lead on the opioid crisis. And currently he serves as the second vice president for the Fire Chiefs Association of British Columbia and is the vice president for the Greater Vancouver Fire Chiefs Association. Mark Griffune is the deputy fire chief of community risk reduction and deputy emergency program coordinator for the City of Surrey, and he's responsible for emergency preparedness and community engagement. He's been active in the organization as a firefighter since '94 and was promoted to management in 2016. Shelley Morris has been a member of the Surrey Fire Service for 24 years and started as a career firefighter. She moved through the ranks to the position of captain and into her current role as the assistant chief of community engagement and emergency management. And with that, I will turn it over to them and let them do the talking.
Great, thank you, Stanley. So thanks for the nice introductions for myself and my team. We're very pleased to be participating in this webinar today, sharing part of our first half of our journey to HomeSafe, our program. I'd like to acknowledge the previous fire chief and data researcher, Len Garris, who I see is on the call as well. Len did most of the heavy lifting and all of the data and research parts that brought this program together over a significant period of time, which you'll hear about today. And then the second session will focus on all the operationalization components of making this program work while engaging our staff and community volunteers and ultimately the public to get higher rates of working smoke alarms. So it's my pleasure to turn this over to Deputy Chief Mark Griffune, who is going to start the presentation and explain. And we do encourage questions in the chat because we've got a good amount of time to answer questions at the end. Okay, with that, I'm going to turn it over to Mark.
Thank you, Larry, and thank you, everyone. Welcome to our HomeSafe presentation on behalf of all of us. As mentioned, we're going to talk today about the research and the background behind this program. The city of Surrey is located on the west coast of British Columbia. For those who don't know, we're the 12th largest city by population in Canada, and we have about 600,000 residents in our city. It's consistently one of the fastest growing populations in the country, gaining an average of more than 12,000 people each year. Many estimates predict that we are on track to become the most populated city in British Columbia within 20 years. Back in 2005, when the HomeSafe campaign was begun, we had about 203,000 residential units. We have 203,000 residential units now, compared to about 143,000 then. So there's been significant growth over the course of this program. The city of Surrey's southern edge lies along the United States. It's bordered by ocean beaches and by the Fraser River. It's known as the City of Parks, and it has over 6,000 acres of parks, trails, gardens, and green spaces. It has 7 neighborhoods designated as town centers: Cloverdale, Fleetwood, Guildford, Newton, as well as Surrey Center, South Surrey, and City Center, which is encompassed by Whalley. All of these are divided across the middle by agricultural land. Almost 1/3 of Surrey's area is designated farmland, and agriculture has been an important part of Surrey's economic well-being since the beginning. At the same time, Surrey is one of the largest industrial centers within British Columbia, including high technology, clean energy, advanced manufacturing, health, education, agriculture, and arts. It has a rapidly developing downtown core with 43 existing high-rises and another 30 currently in various stages of development. We have 2 major post-secondary educational institutions, as well as a major hospital and another on the way. Surrey recently opened a $68 million biofuel facility, the first one in North America. It's also home to a 14-acre Hollywood film production facility, which converted a newspaper printing plant to include one of the world's longest and tallest sound stages. Hundreds of movies are filmed in the city every year, many of them at the City Hall Plaza. There are 6 employers in Surrey with more than 1,000 staff, including the Regional Health Authority, the local school district, and the City of Surrey itself. Surrey's HomeSafe fire prevention program was implemented over more than 14 years. It's an evidence-based intervention and prevention fire safety campaign to protect the community from the risk and consequence of residential fires. This table represents longitudinal analysis of its effectiveness, achieved by measuring each initiative against several fire-related outcome measures. The program was inspired by a success story in the United Kingdom. A study was published by TriData in 2007 for the U.S. Centers for Disease Control and Prevention and the National Center for Injury Prevention and Control. It aimed to study global best practices for reducing residential fires as part of a mission to reduce residential injuries in the United States. The idea was that examples of success around the world might be adapted to North American environments. The study revealed that of all the nations in the developed world, British practices stood out. Back in 2004, new legislation in Britain required fire brigades to engage in strong community safety programs. A national level community fire safety center was formed, and every British firefighter is now expected to actively participate in fire prevention. The resulting culture change was revolutionary. The best practices that resulted from this new prevention strategy fell into 8 categories: finding and understanding high-risk households, staffing and training for prevention programs, home safety visits, national and local fire safety campaigns, school and youth programs, programs for the elderly, safer consumer products, and fire stations as safety hubs in the community. In order to deliver these best practices, local fire brigades were provided information that linked fires with socioeconomic data to understand where high-risk areas were located. These areas were then targeted with safety programs. Practice delivering community fire safety programs was included in recruit training. Fire brigades were given discretion to balance the dual priorities of prevention and suppression in their communities. Prevention was reorganized as part of suppression instead of support, and firefighters were expected to participate. National standards for response times were lowered to allow the trade-off of resources from suppression to prevention. Homes were visited by firefighters to install and test fire alarms and educate and check on other hazards. Civilian specialists joined firefighters when there were language issues or other functional needs relating to the nature of specific households. A call center was set up to manage requests and scheduling of home visits. Referrals were encouraged from other social agencies or people who had home visits and knew others who would benefit. National advertising campaigns were delivered through all available media channels. Ethnic media was used when appropriate for target audiences. Live media was run at high-risk times, for example, cooking safety at dinner time. School programs were developed to reach nearly 100% of elementary school-age kids. Social service workers caring for the elderly were given training on fire safety practices. Firefighters visited homes of high-risk elderly people. 10-year tamper-proof smoke alarms were installed by firefighters. Hardwired smoke alarms were required in new construction and renovations. Portable home sprinkler systems were required in extreme risk households. And new fire halls were constructed with reception areas and spaces for demonstrations. All this work in the UK resulted in a 40% drop in fire deaths over 15 years. Recognizing that we did not have the resources or the direction from a national program, we considered how Surrey might be able to accomplish something similar. We started with our own Surrey research to find out the most common causes of residential fires, and we found out the top 3 were people, people, and people. So we hypothesized about how we might be able to deliver prevention messaging to a population of around 500,000. And we realized that targeted interventions would be a more effective way to utilize our resources than the traditional approaches to public education. We used the following research studies to design the program and measure its effectiveness. The first study, Residential Fires in Surrey, was completed in 2009. It was intended to provide the Surrey Fire Department an understanding of risk factors connected to fires and related injuries across the city. The study provided an initial view and a more in-depth examination of residential fires in Surrey. The data revealed the most common source of fire was cooking. There wasn't a working smoke alarm present at many fires. And different communities within the city have different needs in terms of risk factors and how they could be managed. Almost 5,000 fires over 20 years were analyzed. Over these 2 decades, the rate of fires steadily increased to 88 fires per year per 100,000 people. 75% of these fires were residential, and the study focused on them. Fire rates were compared between the 7 distinct communities within the city of Surrey. The source of ignition was compared to the community of residents, which showed that ignition sources varied by community. The study showed that 1/3 of the fires did not have smoke alarms installed, and where they were present, half of them did not activate. The presence of working smoke alarms also varied by community. Several subgroups within the population, including young children and older adults, are at greater risk of injury or death from residential fire due to the fact that they are less likely to be alerted by a smoke alarm and less likely to be able to respond to it. The same was found to be true for those who had a disability or those who were impaired by alcohol or drugs. Children were also found to be at higher risk when they were in the care of a single parent, especially if there was more than one child in the household. Socioeconomic status was also associated with fire risk. Conditions that are related include higher likelihood of living in cheap housing structures, as well as increased risk of smoking and drinking alcohol, and lower education and awareness of fire risk. All these important trends in fire safety informed the design and location of Surrey's HomeSafe campaigns. While the increase in the number of residential fires was expected given population growth, during the period of the study, it was not expected that there would be a declining trend in the proportion of installed or working smoke alarms. Taken together, these statistics highlighted the need for greater public education about residential fire risk and ways to reduce it. It became very clear the best way to prevent death from residential fires was providing the most vulnerable residents time to exit their homes through the use of smoke alarms. The second study, published in the Journal of Safety Research, evaluated the first period of HomeSafe delivery in 2012. It showed that fires were reduced in the city overall, and there was a significant pattern of reduction in the areas where HomeSafe was delivered. It compared the rates of fire between neighborhoods where HomeSafe was delivered and where it was not. It also compared the characteristics of fires between these two cohorts. The review was conducted just over 2 years after completing the first HomeSafe delivery cohort. It divided the data from 2 years prior to the program's beginning so that there were separate pre- and post-HomeSafe periods for comparison. It then looked at the rate and nature of the fires that occurred in the same locations in order to understand the effect of the program. HomeSafe recipients had more smoke alarm activations, and fires were put out when they were smaller. Fires decreased across the entire city, but the neighborhoods where visits were conducted showed higher reductions than comparable locations that did not receive visits. The study suggested that people moving to and from homes would result in the need for neighborhoods at risk to be visited on a recurring schedule. It also recommended further research to understand the difference in effectiveness between social interactions with firefighters and homeowners and simply leaving pamphlets if owners were not available. This study showed that on-duty firefighters were able to reduce the frequency and severity of residential fires through targeted door-to-door education. The third study, Smoke Alarms Work But Not Forever, was also prepared in 2012. It lays out why a comprehensive whole-of-government commitment is the best way to ensure every dwelling in Canada has a functioning smoke alarm. It acknowledges the 3 types of smoke alarms available: ionization, photoelectric, and combination, and a variety of ways in which they can be powered. Regardless of their design, the study revealed that all smoke alarms need to be tested regularly and replaced after 10 years. It also showed each year around 70 deaths in Canada could be prevented if every single home had a working smoke alarm. Risks are not even across society. Households with at least one child, an older adult, or person with physical needs have higher risk. Rental units, low-income households, and First Nations bands also experience higher frequency of fatalities. Smoke alarms reduce property damage by 19% because fires are contained to the object, area, and room of origin. The functionality of smoke alarms deteriorate over time, and the most common cause of failure is a lack of power. It is possible to increase the likelihood of smoke alarms working during a fire through enforced legislation and targeted installations, but the benefits diminish with time, and so the efforts need ongoing commitment. The key to successful smoke alarm campaigns is longevity. They have to be evaluated regularly and adjusted to ensure that they are effective in an ongoing manner. In summary, 3 findings with respect to smoke alarms were confirmed. The presence of functioning smoke alarms saves lives. Smoke alarms begin to fail over time and they need to be tested regularly, and it is possible to increase the likelihood of a functioning smoke alarm being present in the event of a fire. The 2 key objectives to a successful HomeSafe program therefore need to be making an ongoing commitment to confirm functioning smoke alarms in every residence, and applying a consistent approach that can be evaluated for impact taking into account future risk. In 2015, Smoke Alarms Work, But Not Forever, Revisited, builds on the previous report and adds references to 3 related programs. The BC Smoke Alarm Movement, where 41,000 smoke alarms were installed across the province. The Strategies and Actions for Independent Living program, which addresses fall risk for home care clients. And the potential to promote carbon monoxide alarms through fire safety programs. The smoke alarm movement was launched by the Justice Minister and Attorney General of BC and the Minister of Children and Family Development. 60 departments across the province participated and installed 41,000 smoke alarms to the most vulnerable members in the community, with half of them being distributed to First Nations. The report examined trends in residential fires across the entire province following the movement. From 2007 to 2014, the rate of working smoke alarms at residential fires rose by 12%. Over the same period, the occurrence of fire went down 4%. The death rate fell by 42%. The rate of death without working smoke alarms was 2.8 times greater than with one. Comparing this entire period to the previous 4 years, working smoke alarms increased by 26% and fires without smoke alarms decreased by 17%. There was a large variation in the amount of change in communities across the province. Some communities showed greater improvements than others. 75% of First Nations communities participated in the smoke alarm movement. This caused an increase in the rate of working smoke alarms there. Data from the movement showed that structure fires that happened during this period had significantly less property damage, and fires with working smoke alarms were more likely to be confined to the room of origin. Before the movement, First Nations residential fires were 2.4 times more likely to be fatal. A key motivation of the movement was to work in these communities to improve the situation. Worry-free alarms with false alarm resistant sensors and 10-year batteries were distributed through a carefully designed approach to engage stakeholders, partners, and First Nations people themselves. The rate of working smoke alarms increased, though not as significantly as for the rest of the province. This targeted intervention definitely caused an improvement for First Nations, but there's room to do more. There's also a particularly elevated risk of fatality for older members of the community. Increasing smoke alarm coverage for the elderly was another priority for the movement. The Strategies and Actions for Independent Living organization provides training for home care staff on fall and injury prevention. Including surveys and education about smoke alarms in their program resulted in a significant increase in the rate of home care clients having working smoke alarms. When offered, most seniors requested visits from fire crews to check their smoke alarms, and they indicated they'd made changes to increase their fire safety. In 1997, changes to the Ontario Fire Protection and Prevention Act prompted this study to examine the opportunity to include carbon monoxide alarms in smoke alarm campaigns. It demonstrates that there is an overlap in risk for fire and carbon monoxide poisoning in the community. Finally, the study emphasizes that since airborne contaminants deteriorate smoke alarm performance over time, they need to be replaced every 10 years. To make long-lasting, long-term change, commitment across all levels of government is required, and it needs to be renewed continually. The fifth study, Targeted Residential Fire Risk Reduction, was presented in 2016. It was designed to find communities from each province in Canada with the highest risk for fires based on the research from Surrey's HomeSafe campaign. First, it examined contacts with around 40,000 residents and 1,000 smoke alarm installations in Surrey through HomeSafe. HomeSafe was revealed to be overwhelmingly successful. Working smoke alarms increased from 16% to 59%, and casualties were down 65%, and fire rates reduced by 47%. The program was recognized as an effective model that can be easily adopted in other communities to reduce fires and save lives. Using the 2011 Statistics Canada Census and National Household Survey, the proven HomeSafe criteria for households with people over 65 and under 6 years old, lone parents, frequent movers, and the unemployed determined the top 10th percentile of areas within municipalities that would be most at risk of detached single-family home fires. When HomeSafe criteria were applied using the national census data, the model revealed that Alberta, Nova Scotia, Ontario, and Quebec are at risk for fires in 1/5 of their residential populations. From there, the report identified at-risk populations with these provinces at a municipal level. Provincial maps and tables were produced highlighting census dissemination areas that were in the top 10th percentile of the HomeSafe criteria. While this demonstrated that populations with risky criteria can be identified using census data, the report stressed that the addition of local fire response trends should be added before considering where to focus firefighter door-to-door visits. Most Journey of HomeSafe is an evaluation of the entire 12 years of this community risk reduction effort. It provides clear evidence of HomeSafe's effectiveness in reducing the frequency of fires at residential properties, increasing fire-related safety, and decreasing the likelihood of fire-related fatalities in the City of Surrey. The positive impacts are consistently shown not only in properties that were visited, but throughout the entire city. There is another interesting element involved in the HomeSafe journey that occurred on a fire service culture level. At the beginning of the campaigns, fire suppression staff were generally unaware of the science or motivation behind this HomeSafe program. Even without buy-in, however, task-oriented firefighters effectively delivered the smoke alarm and home safety messaging. Careful coordination of activities and cooperation with the bargaining unit gradually created a culture of acceptance. Finally, understanding the benefits to the community and firefighter safety has led to a top-of-mind awareness of opportunities to check and install smoke alarms at non-fire incidents. Firefighters find the experience of checking and installing smoke alarms rewarding and satisfying. Diligent reporting on the presence of smoke alarms at fire responses has now become the norm. The story of HomeSafe success told through all this research is that consistent, systematic, and ongoing smoke alarm checks and installations work. Thanks for allowing me this opportunity to describe the first part of HomeSafe through the perspective of research and goals. As mentioned, the second part of the presentation will focus on operationalization and delivery methods of the program, including best practices. Assistant Chief Shelley Morris will be delivering that presentation next month. We're happy to answer any questions related to the research and analysis of this HomeSafe program. Thank you.
Thanks, Mark, for delivering that. And the key message is that there was a lot of measures put in place, a lot of data collected, and then obviously analyzing and being iterative to adjust our programs to achieve these amazing results and making our city safer. And so that is our presentation, and I'll turn it over to you, Stanley, for any questions.
All right, if anybody has any questions, then list it either in the chat or in the Q&A, and we'll pass them on to our presenters.
Stanley, this is Ed Camo.
Yes.
I do have a question because I'm, as you know, I've been feeding the chat here with all these reports you've been referencing and things like that, putting links in there. And I'm really pretty impressed at the depth of research that was done, and which I find a little bit unusual. Not many fire departments have such a depth of research over so many years. I guess, why Surrey? What was really the genesis of all this? What drove this kind of in-depth research that was being done?
Chief Garris led this initiative for the department starting back in the early 2000s. And I think really what it was driven by is being outcome based as a fire department. What we do reactive response services to our community like every fire service does in emergency situations. But what else can we do to change the outcomes of those events? And obviously the prevention world has lots of opportunities to help reduce the number of calls we go to, reduce the harm and suffering. And so in our world, fire world, we have a responsibility to try to reduce death, fire death, injury, and fire in general. And so this was an area where we could make a difference and be outcome-based with our work. It provides great balance to our community and our citizens, where we can say we actively do prevention work that has proven outcomes that lower all those factors for fire death and injury, as well as still operate a responsive system that meets NFPA standards and goals for response and suppression and medical response activities. So really it's about just being the full circle fire department and delivering on and making a difference where we can.
And
it
kind of
didn't,
from,
sorry, I was just going to, it didn't hurt having a data scientist as the fire chief that understood how to use the data and research to, lead us down the path. And that's why we called this a journey of HomeSafe.
and that kind of leads to another question I had too, that's gone through my mind. What are the logistics of doing something like this? What does it, what kind of partnerships do you need, and what kind of staff time does it take to develop things like this? Because I'm assuming you didn't do it in a silo by yourselves.
No, so I think very early on, there was a partnership between the union representatives and the bargaining unit and the fire department about wanting to make a difference. There were certain, our city's a growing city, as Mark explained early on. So there's been lots of growth challenges, keeping up with pace. And so getting the bargaining unit on board to support this initiative was key. And then I think from my perspective, the second key would have been hiring a data analyst. So we have a full-time analyst that's a PhD that knows how to do the real heavy lifting when it comes to looking at the data. And so you just seen a snapshot of all the research that's been done. There's hundreds of research papers that have been done, and some lead you down dead ends, and then not to put your resources and time into those channels. For me personally, one of the things that I looked at through this program was a transition from what I would call the shotgun public education approach, where you just go out and blast everyone in your community with messaging about test your smoke alarms and do this, and then you rely on them to hear your message and actually follow up. And what really became apparent is that that approach did not change the outcomes that we were looking for. And it wasn't until we did the research to see what our common non-random characteristics were in all our fires that we came up with targeting those areas with a targeted program. And once we did the targeted program, we've seen the results shift. And again, it's like Mark said, people drive all of the public safety workloads, whether it's fire, EMS, bylaws, or police. It's driven by people. So the targeted approach evolved through this process, and it's been very effective.
We do have one question in the chat for you. How large is the division that works on the community risk reduction in your department?
Well, Deputy Chief Griffune is the Deputy Chief of the Community Risk Reduction. Assistant Chief Morris works for Mark and does a lot of the operational components of it, and then the full-time data analyst. We also have 75 community engagement volunteers that sign up to our events and now do the door-to-door. The program was piloted with using firefighters, but with workloads and availability of fire crews not being reliable or consistent due to all the calls we get, we shifted the model to a community engagement volunteer model. So in terms of full-time employees, really there's 3, and then myself with oversight over the program. And a lot of the work is done by our community engagement volunteers, which in the part 2 of the presentation, Assistant Chief Morris has quite a bit of content on that.
Another question. With most departments facing EMS calls, what were the challenges with staying with fire prevention and mitigation as opposed to addressing EMS needs?
So, that's a good question, because those workloads would appear to work in polar opposite directions. So one of the unique things we did is we take advantage of our EMS workload. So when it's not, an immediately life-threatening MPDS code. It's more of a urgent or non-urgent response that we're going to. Our crews will ask the homeowner, maybe not the patient, if we can check the smoke alarm while we're there. So we'll have firefighters attending to the patient. We don't do transport in our jurisdiction. We're first responders, and there's a provincial ambulance response service. So we typically have a few minutes before they arrive on scene. And so it's become part of our culture now, where at the appropriate type of call, our crews will ask if they can test the smoke alarm. And so we get roughly 24,000 EMS calls a year. And so that probably generates about 20,000 opportunities to test smoke alarms in residential settings, which helps inform our program. And what we've done is again, I'm cutting into Shelley's presentation, but we will provide a working smoke alarm if the one present isn't working. And so that has made a huge difference. And so we kind of married the workloads, so to speak, and take advantage of the people that have the opportunity at EMS calls to help support the prevention initiative and community risk reduction initiative.
Another question, has your funding structure changed? Has your funding changed structurally, or are you just working off some one-time monies for this program?
No, the costs to run the program are embedded within our operational budget. And so community risk reduction and prevention in general has its education component budget to support. We've increased it slightly, but to give you a scope, I have about a $70 million operating budget, and the budget to run this program is under $50,000 a year. So it's not a huge lift in my environment to just fit that into my operational budget.
Does that include staff time, or does that include just the smoke alarms, or what does that include?
Yeah, that would include the hard costs, the smoke alarms, supporting the volunteers. They get certain apparel, identification things, props, pop-up tents. They do public events, all the hard costs that go to it. And they are truly community engagement volunteers, so there's no remuneration for them, but we cover all their expenses out of that budget. And of course, my full-time staff are sunk costs because they wear multiple hats with emergency planning as well.
I guess I wonder how they feel like being called sunk costs, but we won't talk about that right now.
They're smiling.
It pays the bills.
Yeah, I do have a question on your volunteers. Where do you get them from, and what kind of background are you looking for, and what kind of training do you give them?
I think I'll let Chief Morris answer that briefly. Go ahead, Shelley.
We have a link on our website, so when they go there looking, and it's also on the city site, so if they're looking for volunteer opportunities, they can then see the departments that offer that. And then it's just then they go into the fire site, and then they click on a link which takes them to create a profile. So I do go into that in quite depth on the next presentation, but at that point it's just basically an interview with me, and then the whole volunteer software that was bought by the city manages. I just go in and upload the events, I describe the events, and it's pretty much self-run. The only part I have to play is just interviewing them and inspiring them. And then it's basically a mentorship program that they teach each other on how to do it. And a lot of them, not all of them, but a lot of them that do HomeSafe want to be firefighters. So they're very motivated to do a really good job, and they do.
Yeah, the interest to volunteer time in our cities is quite high. And what we typically get will be recently retired citizens. I won't necessarily call them seniors, but they are looking to give back to their community in one way. And through our city portals, there's opportunities in Parks and Rec, and then with us for community risk reduction. And then, as Chief Morris indicated, a lot of young volunteers that are looking to become firefighters or work in public safety will put volunteer hours into the program as they're on their journey to become part of the team.
In looking at information, I notice you have a very high immigrant community. Has that been an issue, and how has that factored into designing this program?
Yeah, so it's a great question, Stanley. We had done research along the way. It wasn't one of the papers we showed today, where we looked at the ethnicity and fire problem. And I can tell you in certain areas of our city geographically, we discovered there was a way higher concentration of cooking fires that we could connect to an ethnicity. So we did a targeted outreach program just on cooking fires, another door-to-door education campaign about cooking safety and how to deal with grease fires and et cetera. We did measure it, and it did make a moderate difference. But part of the HomeSafe overall education program, aside from working smoke alarms, does include all that other education component too about cooking fires, smoking materials, the risks of balcony fires and multi-residential settings, et cetera, is all encompassed now under the HomeSafe education. And we do publish some of our brochures in multiple languages to get to those audiences that may not have English as a primary.
I don't have any more questions here. Do we have anybody else interested in asking question with a question to ask of our presenters? Who are the volunteers trained by is a question that's just popped up.
Chief Morris does the orientation with all the volunteers. So the volunteers do go through appropriate screening through the city process, criminal record checks, et cetera. And then when they sign up to work for our initiatives, Chief Morris meets with them all, explains to them the program, makes sure that she's inspiring them to help make a difference in our community. And we've really simplified the process. So pretty much anyone can be a volunteer and deliver the material. That is covered in the operational presentation in September. But yeah, Chief Morris trains them and then they train themselves. There's certain volunteers that have been with us now for a certain length of time. We always team them up when they go out in groups, and there's always someone with more experience. And so they pass on the knowledge to the newer ones, and it's very effective.
Are there any liability concerns?
Not from our perspective. So when we're installing a smoke alarm, we do have an indemnity or a waiver of release from the owner. We do need to get their permission. And so it's done on the basis that they're aware of what we're doing, why we're doing it, and what we're doing. So with that, our risk management department has determined that there's very, very minimal exposure to risk with this program.
And if we have any more questions, put them in the chat or in the Q&A, and we'll pass them on to our presenters. On the liability concerns, does that include the educational portion as well?
I would say yes. For liability to incur, we would have to be promoting or instructing people to do something that would probably be considered negligent or grossly negligent compared to all the literature that's out there. And so we do adopt NFPA messaging, and we do adopt it to our environment in our city, but all the core messaging is supported by the large body of educational material that's out there. So we're not going to go out on a limb and tell someone to do something that's totally contrary to what the best practice is. So we do not see any liability with the education. You're welcome.
All right. Well, thank you so much to our panelists for being with us today. And thank you so much to our attendees for joining us and for the excellent questions. As we mentioned previously, we'll be posting the recording to the IPSDI website in the training section. So please feel free to go back and reference that or share it with others. Ed has linked our website in the chat, as well as the registration for the part 2 of this series, which will happen on September 23rd at 1 p.m. So I hope that everyone has a great day, and we hope to see you all next month.
Thank you. It's our pleasure, and we look forward to September for part 2.
Great.
Thanks.
Thank you.